as a person living with cancer myself, one of the things I know that is often focused on by my healthcare team is the standard of care. And then it's more of a reactive approach to dealing with symptoms. Talking about goals of care seems more proactive. So for a patient going in and wanting to talk about goals of care, maybe it's not brought up by their care team. Would it be appropriate for that patient to say, hey, I'd like to talk about some goals for my care too, not just have it be a reactive approach, but more of a proactive approach? Would that be a weird thing to ask the care team, or is that appropriate for a patient to ask that question? Can we have a conversation about the goals for my care?
No, I would love if a patient said that to me because these are conversations that we want to have with patients. We want to have an open communication so that everybody's, on the same page of understanding of what's going on with their cancer. But patients are often reluctant, and I get it. To be honest, a lot of doctors are reluctant. Sometimes they feel awkward in the conversation. So it goes both ways. But if the patient is open and wants to have that line of communication, I think that's great. When I say goals of care, I mean, what are your goals out of the treatment I'm giving you? And, it's interesting because you bring up a good point. In small cell lung cancer, goals of care are very important because there's a lot of things we can do to you. Some patients do not want their whole brain radiated. There's a risk there of loss of cognitive function. And especially in the extensive stage setting, um, we can offer it. There is actually a slight advantage in survival to doing preventative whole brain radiation. However, the trade-off is that you can have neurologic decline and physical decline from that. So it's like, do I want to take the risk of having that side effect to prevent the brain metastases? So these are goals of care discussions. Like, is this right for me? Is this something I want to do and risk feeling this way? And some of that may depend on your performance status, which is something that we use to say, like, do I have a lot of other conditions? Like I have bad COPD and I'm in a wheelchair already. And if I get this whole brain radiation, will I never walk again? Something like that. Those are all things that is important to discuss with your treatment team.